Okay, guys, sorry about that. I am re recording this portion. My dog ruined the first recording. He may make some noise later. I'll try to keep it out of the video. We're going to talk really briefly. This is the shortest video. Signs of pregnancy. Presumptive signs can be attributed to a lot of things, but taken together, they usually are the first clue that a woman might be pregnant. These are things like nausea, vomiting, tender breasts, fatigue, missed periods, abdominal growth. Usually, if a woman has all these symptoms, it clues her in to the fact that, yes, I might in fact be pregnant. And that will prompt her usually to take a pregnancy test. So, all of these things could be attributed to stomach bugs or PMS, stress, but they are presumptive signs of pregnancy. They're usually the first clue. Probable signs of pregnancy, just ignore that dog. He's crazy. They could be attributed to other causes, but they probably mean you're pregnant. Those other causes are a little more far fetched. For example, a positive pregnancy test. It could be caused by a pituitary tumor, and in some cases, menopause will cause a false positive. But generally, if you have elevated levels of beta HCG and they are detectable in the urine or in the blood, you're probably pregnant. That's usually what it means. And then we have some of these signs. Chadwick sign, which is a bluing of the cervix. It happens because of increased blood flow to the cervix and the rest of the uterus under the influence of estrogen. Hagar sign, which is a softening, and Goodell sign, which is the ability to flex the cervix of the uterus against the body of the uterus. Those things would be detectable on a pelvic exam, a speculum exam, or digital manual exam. And maternal perception of fetal movement. Generally, especially experienced moms, if they say, I think I felt something kick me, they're probably pregnant. I mean, sometimes it's just peristalsis. But most often, if a mother said, or if a woman thinks, I just felt something kick me, she's probably pregnant, but not definitely. Positive signs. You are definitely pregnant if you see a baby, hear a baby, or feel a baby. And this means that you visualize a baby with an ultrasound machine. Used to do it by x ray. We know x rays are teratogenic. Fetal heart tones with a Doppler or fetoscope or any other instrument that records fetal heart activity. And palpable fetal movement assessed by an examiner, not a self-report by a patient. But if you put your hands on someone's abdomen and you feel something kick you, yeah, they're pregnant. Um, so that's going to be on your test. Now let's talk a little bit about psychosocial adaptation. In the first trimester, women are very ambivalent. In the second trimester, there is a growing awareness of this fetus as a separate entity. And you're dealing with the body changes as you become more visibly pregnant. You need to wear maternity clothes. Maybe you need to wear a different kind of bra. You're dealing with all the normal discomforts of pregnancy. And by the third trimester, women move into that phase where they are intensely focused on preparing for the birth and eventually parenting a new child. And at this point, there can be lots of anxiety and a feeling of being very vulnerable. Um, and that's why it leaves women immune to things like Facebook groups. It's a way to examine their feelings as themselves as birthing people. And they may identify with some of those fringe groups. We'll talk more about that through the semester. But these are the phases of psychosocial adaptation. So if on an exam you get a question about a mother who comes for her first prenatal visit in the first trimester and she's just not sure if she's ready to be a parent, she doesn't know if she can handle it, does not indicate a risk factor. Anyway, we are done. Thank you for your time and attention. I will see you in class.